This debate will be about how to better control patient outcomes in CRDs by integrated care pathway solutions. Let me shortly introduce our guests. May I ask each and every one of you to give a brief description of who you are and which field you are working in?
My name is Gert. I'm the Managing Director of EUFOREA.
I'm Peter Hellings. I'm ENT surgeon from Leuven, Belgium.
I'm Omar Usmani. I'm a consultant physician at Imperial College London.
I'm Jean Bousquet, apparently retired.
I'm Andrew Nill. I'm a patient from London.
Hello, I'm Anne. I'm also a patient living in Belgium.
Jörn Wittman, a Managing Director of Scope Europe, an organization taking care of data protection in the digital world.
And to give us an overview of this topic, I pass the floor to Gert Mariën.
Thank you. There are three winning moves in order to better control patient outcomes in chronic respiratory diseases. The first winning move relates to the design and implementation of integrated solutions and integrated care pathways, essentially solutions from prevention to diagnosis, treatment, and follow-up, whereby all the stakeholders participate. The second winning move relates to the leverage of digital capabilities, which are required to support these integrated solutions, and they will enable digitally enabled patient and centric care. The third winning move relates to, or is about implementing relentlessly and courageously these integrated and digital solutions to accelerate change in day-to-day practice. So let me take you through the solutions, these integrated solutions to better control patients with chronic respiratory diseases. In the first solutions, we need patient educational programs in order to increase the awareness of patients and first-line healthcare providers so that they are much more aware about the disease, the treatment options, the complaints, and this will also enable early detection and more adequate diagnosis of GPs. This will eventually improve timely access to the right treatment of patients. In the second solution, physician education, very practical and evidence physician education, will help us to support better implementation of guidelines into practice and will also contribute to better adherence of medication of patients. This will eventually also increase the effectiveness of treatments. In the third solution, we need outcome registries to collect real-life world evidence, both clinically and health economically, so that we have better information available for more research, but also to exchange best practices amongst physicians. In the fourth solution, we need to deploy integrated care pathways. This is very much important in order to enable multidisciplinary but also transmural collaboration from first, second, and third line of care. And this will enable that patients will be exposed to the right treatment at the right moment, at the right location. So these are the four solutions we might consider to improve better outcomes in chronic respiratory diseases. Implementing those solutions is for sure not easy, but they can certainly be leveraged by digital capabilities. We need digital capabilities to support these solutions. Let me take you very briefly through a few digital solutions. For example, e-learning platforms for patients might be very interesting them to provide them unbiased and adequate information about the disease and treatment options. Of course, it's very important here to expose them to these educational platforms. Patients are seeking a lot of information on the internet, but cannot always find correct information. E-learning platforms for physicians might be required to provide continuous and immediate access to the last educational materials across novel treatments. Outcome research and outcome registries are required to do benchmarks and further enable further outcome research. Let me take you through the digital app. We have the allergy diary, we have the My Sinusitis Coach. These are not just simple apps. They are a compass for patients to organize their care, to enable self-management, but also act as a kind of measurement instrument to enable an outcome registry. And last but definitely not least, physician dashboards or clinical decision support systems can help physicians in day-to-day practice in the implementation of new guidelines. It will also enable them to keep track of patients' symptoms and react proactively and make sure that patients are brought into the outpatient consultation with priority. So these digital solutions are required to support solutions throughout the integrated care pathways. Now, let me take you to the following. It's very important. It is of fundamental importance that we implement these solutions relentlessly and courageously. to accelerate a change in daily practice. There are two things which are very important. We need to collaborate together so that we can leverage all our capabilities and create synergies. This will create traction in the market. And secondly, there are a few implementation barriers that we need to overcome, that we need to manage. For example, legal compliance, that relates to GDPR, technology constraints, but also resistance to change, where we have to mobilize commitment of people. So in this debate, and I conclude here, we will review a few things, and these are the following. We will ask the patient on their reflections of their experience in day-to-day care delivery. We will talk about what is the role of digital to improve patient education, but also physician education. We will talk about the role of digital in the deployment of integrated care pathways, as well as in the deployment of an outcome registry. And eventually, we will finalize the debate with discussing the barriers to implementation.